Moments ago, the president made a critical promise of major financial help as Americans make unprecedented sacrifices in the wake of this coronavirus pandemic. The number of infected has now crossed the 5,000 mark in the country, with deaths approaching 100. Now, President Trump plans to send some kind of cash infusion to people as they follow the guidelines that go along really against most of their basic instincts to stay at home, do not eat out, don't go be with your friends or big groups of people. Over really 10 people or more is the number they're saying.
I think we're going to do something that gets money to them as quickly as possible. That may not be an accurate way of doing it, because obviously some people shouldn't be getting checks for $1,000. And we'll have a pretty good idea by the end of the day what we're going to be doing.
We want to make sure Americans get money in their pockets quickly. We want to make sure small business owners have access to funds. We want to make sure that hotels, airlines, we have an entire package.
The president also said all 50 states are now authorized and can do their own testing. Plus, moving past his back and forth with New York's governor, President Trump said he is now working on helping the state expand its hospital bed capacity. New York has the most cases in the country, with more than 1,300 people infected.
Well, we've been asked to
increase capacity?
Yes, we're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary. The state is working on it very hard themselves, but we'll probably supplement what they're doing.
In the meantime, additional states are cracking down on people making non-essential outings by making assemblies of 25 or 50 or more illegal. The city of San Francisco actually has a shelter-in-place directive calling for people there to stay put. And the state of Ohio called off its presidential primary today. But those latest developments are just a few of the disruptions that continue to come from the coronavirus pandemic. Let's take a broader look now with CNN's Nick Watt. Nick is live in Los Angeles. And listen, this is affecting every single one of us in every sliver of our lives.
Absolutely, Brooke. Texas just joined the list of states activating the National Guard. Florida just said groups of 10 or fewer now only on the beaches, and those groups must keep 6 feet apart. And, you know, we heard Steve Mnuchin actually talking about mailing checks out to people. Moody's now saying that perhaps 80 million American jobs at high or moderate risk, in part because of all these measures we are now taking to try and stop the spread of this virus. Early opening in Houston, seniors only, keeping them stocked up and safe from other shoppers. In San Francisco's Bay Area, 7 million woke to a draconian dawn, now allowed out only for essential needs.
Life is turned upside down. It's just turned upside down.
Good morning, everyone.
Brooklyn's DA has stopped prosecuting low-level offenses that don't jeopardize public safety.
The president also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly.
Federal officials warning there aren't enough gowns, gloves, and masks stockpiled.
We would urge construction companies to donate their inventory of N95 masks to your local hospital.
We've ordered massive numbers of ventilators.
I went in getting tested.
Miami's mayor from self-quarantine now, following New York and others in shutting all gyms, clubs, bars and restaurants, apart from takeout.
This could be a crisis of at minimum several months, and we have to start being honest about the human impact. If people are without their income for months on end.
At the 11th hour, Ohio postponed today's presidential primary, possibly until June.
It was simply untenable for us to continue telling Ohioans to go to the polls.
Florida, Arizona, and Illinois went ahead. This voter in her 70s with underlying conditions, wearing mask, muffs, and gloves.
This election, it's always important, but it's ultra important to me this year.
All AMC and Regal movie theaters now closed nationwide. Same with all McDonald's seating areas. And for the first time since the Second World War, the Kentucky Derby will not be run the first weekend in May. The world's busiest airport, Hartsfield-Jackson in Atlanta, has closed some security checkpoints. Decline in demand, they say.
This is worse than 9/11. For the airline industry, this is, they are almost ground to a halt.
Meanwhile, Amazon is hiring another 100,000 workers to meet online shopping demands. And the billion-dollar question, how long will all of this last? We don't know. The governor of New York said it could be another 45 days before they even see a peak in cases in New York State. And Dr. Anthony Fauci of the White House Task Force fame, he says it may be several weeks or even longer, Brooke, before we even know if what we're doing right now, all of these measures, are even having an impact. Brooke?
At least Amazon is adding workers. I was just buying home weights and another yoga mat just to, keep working out at home while we stay sane through this whole entire ordeal. Nick Watt, thank you in Los Angeles. To the medical expert, Anne Rimoin is a professor of epidemiology at UCLA and the director for UCLA's Center for Global and Immigrant Health. So, Dr. Rimoin, thank you so much for being on with me. I got a bunch of questions for you. Just starting with, we played some of the sound from the president off the top when he was speaking this morning, and he is giving more power to the states in terms of testing, for example. Do you think that will be effective? Will that work?
Well, I think it's a very good idea to give states more powers. There's no one-size-fits-all solution for outbreaks or for epidemics, and certainly not in a pandemic scenario. We learned this. I've spent many, many years working on Ebola, and what we've learned there is that you can have general regulations, but what you really need is to tailor solutions for each population. California is very different from Alaska, which is very different from Mississippi and from Wisconsin. So it's going to depend upon the density of people, how people are generally interacting, where the hospitals are, how people can get care. I mean, all of these things need to be taken into account when thinking about how to manage an epidemic of this scale.
Sure. And in terms of people getting care, President Trump also mentioned today, basically gave the green light to the Army Corps to build more hospital beds as health officials sound the alarm on the stockpile shortages. You tell me, what medical supplies are needed the most right now?
I think there's a whole host of medical supplies that are needed right now. I mean, we know we need more ventilators. We know we need more of the supplies that go all around ventilation and managing care for people who have respiratory problems. But the biggest thing that we need to think about right now is the personal protective equipment, what we call PPE. And this is something that is going to protect our healthcare workers. And I think that the big issue that we have not been able to solve as of yet is how healthcare workers are going to have enough PPE. We know that hospitals are running out and that this is the rate limiter. We have to protect our healthcare workers. They are our most precious resource in this issue, and they're on the front lines and exposed without what they need to protect themselves.
To that point, we have heard about 200 nurses at one facility being exposed. 9 doctors down at Emory in Atlanta have gotten sick. If this continues, the question I'm getting from a lot of people is, how do we make sure we have enough doctors and nurses just to fight this, let alone people are still breaking arms, having heart attacks, etc.?
Well, you're not going to be able to fabricate new nurses and doctors in a matter of days, unfortunately. So what you need to do is you need to be able to protect these healthcare workers. I know I'm repeating myself, but it goes back to the same thing. You have to provide them with the tools that they need to protect themselves, and that is personal protective equipment. They have to have the masks. They have to have the gowns. They need to have the goggles. They need to have gloves.
If they're in short supply, how are they going to get them?
It's a very good question. I think that the government really needs to think about this and to take drastic action to ensure that they have these things. The general public doesn't have it either. I mean, hand sanitizer, gloves, all of these masks, all the equipment that I've just mentioned. There has to be a way. They're going to have to find ways to be able to provide these materials, whether it's working with industry or finding other solutions. I mean, I don't, that part luckily is not my job, but I can tell you that's what we need.
Yep. I hope the government's listening. I know they are. Also, and I'm going to set you up for a question that you really may not know the answer to, and that's okay. But everyone sitting here is like, all right, how much longer are we going to have to endure this, right? So President Trump said today he wants people hunkering down for 2 weeks. I was listening to Governor Cuomo here in New York this morning saying it'll be 45 days before just the state of New York alone sees its peak. Realistically, how long do you think we are going to be living in this hunkered down reality?
Well, I wish I could give you an answer that would that would make everybody feel better. But the truth of the matter is we don't know. What we can do is we can look to other countries. There are other countries that are ahead of us in this epidemic curve. So we can look to Italy, we can look to South Korea, we can look to Singapore, we can look to China, and we can also look to see how these countries managed these outbreaks and understand what's happened as a result. How long we are in this situation is directly linked to how well we manage it, how well people are following social distancing. And I think that is a very big issue. People have to social distance. They have to respect that. And we have to be able to empower our healthcare workers. I think that these are the key things that we have to be able to do. We have to be able to flatten the curve, and that takes everybody working together to do it. And if those things are in place, then it's very possible that we'll be able to get out of this situation much sooner.